You mentioned the idea that they're going to eliminate the Medicare Advantage program and go to the Medigap. Can you give us a short difference between the two?
Yeah, the Medicare Advantage program has a lot of flexibility in it, where patients can use their Medigap Advantage program for a lot of different services. You can almost kind of cherry pick what you want to use. There's a lot of variability of what can you use it for, a lot of flexibility, and it's a very cost-effective product. The Medigap program is more expensive and it has fewer bells and whistles to it, and you have far less choices. And as I said, its big sponsor is United Healthcare out of Minnesota, and United Healthcare is the sponsor for AARP's program. So, more expensive, less choices. Yes, sir.
If you don't mind, I wanted to back up a little bit to your preventive medicine part, if we were back to that for a moment. You mentioned Rick Martinez, that I've known. So my question is, what do you see as the government's role, regulatory role, in helping prevent some of these injuries? That was certainly Rick's career move. Do you see a role for the federal government in helping with regulatory changes for the various industries to bring down injuries?
I do, but a little different than what most folks would advocate. There's a chapter in my book called "A Grunt Goes to Washington," and I was asked to testify in front of a congressional committee, and it was about our research that had prevented all these injuries and saved all this money, and it was the first time I had testified in front of Congress, so I was a real rookie there. And it's a funny story, and it's in the book, but Mary Tyler Moore testified right in front of me about juvenile diabetes. Very nice lady. And she asked for some ungodly amount of money for juvenile diabetes research. I don't know, 150 million, 200 million. I mean, it was like, holy cow. So it's my turn to go. Oh, then there was another guy who spoke about something. And I noticed, like, when she testified, all the congressmen were listening, and yes, And when this guy testified, they were all talking amongst themselves. So I'm sitting next to this congressional aide, and I go, why are these guys talking? He goes, well, that's what they do. I go, what? He goes, yeah. It all gets written down, and they just kind of sit there, and they talk amongst themselves. And I go, it's not going to happen when I get up there. And he goes, it happens to everybody. I go, it didn't happen to Mary Tyler Moore. He goes, you don't look like Mary Tyler Moore. I go, okay. So I get up there, and I start testifying, and there was this guy who'd been in the House for about, 60 years. His name was Natcher. He was out of Kentucky. And he's the chairman. And I start my presentation, and I look up, and he's talking to these other congressmen. So I stop, and I go, Chairman Natcher? He goes, yeah. I go, do you have a question for me? He goes, no. I go, well, yeah, you did. Because you were talking to the guy next to you. And obviously I had a question. Now, my guess is he didn't know anything about this. I do. No, I'm okay. I go, okay. So here's the deal. I go, you're never going to hear this again, this presentation. So I'm going to start over. And when you guys start talking amongst yourselves, I'm going to stop, and I'm going to start over. So I gave my presentation, and they were quiet. And I got done, and this aide, I sit down, he goes, I've never seen, he goes, that was like a kamikaze pilot, man. And I go, well, they haven't heard this stuff. They need to hear it about the focus on prevention. Hearing's done. And I hear this southern drawl come out. Dr. Janda, get over here. Natcher. And the aide goes, he's going to kick your butt, man. He goes, this is going to be just bloody. I go, okay. So I walk over there, and he looks at me, and he goes, I've been here for many years. He goes, you're the only guy who came in front of us and never asked us for money. I go, right. He goes, how much do you want? I go, I don't want a penny. He goes, what? I go, I don't want a penny. He goes, I've never heard anybody say that here. I go, here's the difference. You guys have the media at your beck and call. Stop wasting our money on garbage. You bring the media to this issue, and you'll help every person in our country. Take the media spotlight and shine it on it. That's what I want. No money. And he looks at me and he goes, well, I thought you were kind of off when you talked to us and kind of made us shut up. But he goes, now I know you're really off, son. And he walked away. So I don't want the government jamming prevention-related issues. I want them to point out what works and what doesn't work. And I truly believe in people. As I said, you give me one mom in a community that gets our information, it's safer in a month. I mean, they get it done. They get it done faster than any government agency ever could at no cost. So I truly believe if they would just focus on educating the people and getting the information out and not spending all this money doing studies and paying this and paying that. But there was something that happened out of this that was completely inadvertent. What they ended up doing is based on my recommendations, and it was on sports-related injury, in particular softball and sliding and all this kind of stuff and breakaway bases. They changed. They actually looked at it and they saw that they were spending tens of millions of dollars in the federal penitentiary system and in the military and the Defense Department on sports-related injuries. And they mandated some of the things I talked about in my testimony at every federal penitentiary field and every military installation around the world, which led to tens of thousands of reductions of injuries in that population. So even though the vast majority of the law-abiding public does not benefit from our research, Charlie Manson is playing on the safest fields. I'm not kidding you. He's playing on the safest fields in the world. So.
Okay, I think we'll wrap it up. We'll have one more question.
I've got a question.
Go ahead, sorry.
Yeah, Dr. Janda, how is the illegal immigration situation going to affect this bill? We've got something like 12 to 20 million illegals that Obama says aren't covered by this bill, but he's trying to make them. And in fact, he's even threatened to do it by executive order. When these people come into play, how is that going to affect Obamacare?
I mentioned that the administration has, depending on what day you listen to him, one day it's 40 million people will now be covered, one day 48 million, one day 50 million is the highest I think I've heard. On average, the number that keeps coming up more regularly is 32 million. What I did is I don't believe that number, by the way, and understand something. I dare you to show me somebody dragging their broken leg around Livonia, Michigan, Ann Arbor, Michigan, or anywhere in the country because they haven't been treated. It's not who doesn't have an insurance, it's who's not being treated. Because when it comes to not being treated, folks are being treated. I can tell you in our office, 53% of what I do is written off as bad debt and charitable care. Okay? So if there's anybody in this room that wants everybody to have insurance, I'm the guy. But I want it to be affordable, and I want people to be in charge of their product, not a government bureaucrat or an insurance company or an HMO. I sat down with some folks on the other side, and I said, let's take your 32 million figure. I want you to identify where these people are, okay, who they are. They could identify 12 million people. So when they say that 32 million people are going to be covered, the 20 million, they identified 12 million, the 20 million are illegal immigrants. So they are.
Okay. Rhonda, one more. Yes, I've heard some conservative radio show hosts that say that if the Congress is taken over by the Republicans, that they could make some efforts there to not fund the program here or try to repeal it outright. What do you think about that?
I don't care who takes over, but this is what I tell people that are running for office. You get into office and you don't repeal this, you don't defund it, I will personally find somebody to run against you and beat you the next time. I was very disappointed in the previous Republican administrations. It led to me being thrown out of the White House. It led to me being branded as disloyal and not being invited back to the White House under George W. I'm not a bad guy. I just hit them with the truth, and a lot of times they don't like the truth. I think that if the Republicans do win in November, and I think there's a very good possibility that will be the case, I believe if they don't immediately, sincerely do everything in their power to repeal it and defund it, I think they will be voted out of office, and I believe you will see the largest push for a third party than you've ever seen in your entire life. I like to hope that they will do it every chance I get, and I think that's one of the things I encourage people to do, is if you're going to support somebody, I put my contingency on supporting somebody. There are several, but one of it is you're going to repeal it and you're going to defund it. And if you don't immediately step on the gas pedal, the minute that gavel hits, I am going to let everybody know that you have nothing to do with freedom and you're part of the oppressive class. I just lay it on the line to them. I think there's a good chance they will. As I said, Thad McCotter has this 2-page bill out. You got Steve King coming at it. Now you even got Boehner. Let me tell you something. When I gave this talk to congressmen, and this was on July 16th, 2009, at the end, I looked at them and I said, this will take everybody's freedom, this bill. I go, you guys have an opportunity, and if you handle this right, you will get the majority back in the House and the Senate. And I'll tell you the reaction. They looked at me, and they looked at McCotter, and they were like, okay, where did you dig this psychotic up from? Because this is crazy. Well, even those people that looked at me like I was from Mars on July 16th of 2009, I've heard from in the past 3 months. And he said, you know, I thought you were a little off when you talked about this, but you're right. And I said to him, I wish you would have figured this out 9 months ago. Why does a little old country doctor from Ann Arbor, Michigan have to lay it out to you? So if they need to show what they haven't shown in many years on the Republican side of the aisle, if they do turn around and get this thing, really put the heat on it, yeah, I think there's a really good chance. But understand something, there's going to be a lot of pressure on these folks. Because you know what? The insurance companies love this. Don't buy into that. They don't love it. They spent hundreds of millions of dollars getting this thing through. Why? Because everybody's mandated they're going to buy the product, and guess what? They got an IRS that's going to enforce it. Man, they never had that before. Pharmaceutical companies love it. They cut a special backdoor deal with Obama where no importation of drugs for 10 years. Yeah. And for 10 years, the pharmaceutical companies, no oversight. That was the deal he cut with them. Yeah. No, there's going to be a lot of pressure on these guys to go the other way. But I'll tell you something. I think, and again, you can love them, you can hate them. But one thing that Tea Party organization does, it holds the people's feet to the fire that are running for office. And that, I think, is a good thing and not a bad thing.
Okay, great. Again, thank you, Dr. Janda.